Coronavirus cases are rising at an alarming rate in 49 states, including Texas. Here's a look at the numbers. The Department of State Health Services reported more than 6,800 new cases today, bringing the state's total to nearly 1,028,000. Grim scenes continue to unfold in El Paso, a hotspot for the virus. The city reported 1,550 new infections this morning. More than 200 people have died in the county in the last month alone. And in Bexar County, Metro Health reported 133 new cases yesterday, bringing the county's total to more than 70,000.
Nationally, at least 27 states have imposed new coronavirus restrictions on businesses and gatherings. It comes as the nation added nearly 1 million new infections in less than a week. Experts at hospital systems nationwide could be just weeks away from their breaking point without more targeted restrictions.
My worst fear is what we saw happen in other countries where people were dying on the streets. People literally were dying in the waiting room of emergency rooms after spending 10 hours just waiting to be seen.
There is hope in the fight against the virus. Pharmaceutical company Moderna says its new vaccine is 94.5% effective. Last week, Pfizer said its similar version of a vaccine was more than 90% effective. The government says both vaccines will be free and will likely be available for some high-risk people by the end of the year. Widespread distribution expected by spring 2021.
As hospitals prepare for a winter wave of the coronavirus, healthcare workers are still trying to recover from the past 8 months.
Eyewitness News reporter Marvin Hurst explains why the crush of the virus and the deadly impact increases the need for doctors and nurses to address their own mental health.
They are the heartbeat of health and wellness.
We never expected this many people, this many patients, this sick.
Since mid-March, the coronavirus pushed doctors and nurses to the brink.
Terrifying. It's a whole different world in intensive care.
Melissa Gonzalez is a nurse in the ICU at University Hospital.
Emotionally, physically, psychologically, it was hard on us.
Underneath the PPE and behind the critical care training is a human being who witnessed the coronavirus kill 6 patients in a day.
6 patients in almost a 24-hour period. I mean, we were left in an utter state of shock.
But she won't let herself process that because duty calls.
We would like to say we would put it behind us, but unfortunately, we're preparing for another surge.
Experts believe so much exposure to that level of work opens the door for challenges like PTSD, anxiety, depression, and substance abuse.
The challenge for them is that this has just been going on at such a high level for so long. They're just tired, particularly doctors and nurses who are working in the ICU.
UTSA psychology expert Dr. James Bray says healthcare professionals are trained to deal with trauma, but that doesn't negate the need for therapy.
You know, they're going to need some time off just to recover.
Gonzalez lost her mother in June, adding to her mental pressure.
On her deathbed, she was telling me, you know, Melissa, God brought you into this career. You didn't pick it. God picked you. So you have to move forward. You have to be there for your patients.
That rallied her devotion to the job. Mental health, not so much.
And at this point right now, for me personally, I don't have time. I don't have time to care for myself, but it'll come.
Marvin Hurst, KENS 5, Eyewitness News.